So we will kick things off with our amazing panel that has come together. And so I'll introduce our panelists a little bit now. And then they're going to share first with you their research and then some social issues. At the end, we'll attempt to take at least a one or two questions as well. Feel free and write your questions in the chat box. So that even if we don't have time during the Q&A, we might be able to follow up with you. And so I also just want to have everyone double check that they're muted. There's one person on their iPad. I would love, Dominique, if you could mute. We're not able to mute you on our side. So, I just want to say first, why did we choose this topic? Obviously, there's such amazing research going on and, such opportunities right now to explore some of these questions that, in decades past, we thought we may never be able to really answer, right? We just have to have that hope. And certainly those questions still exist. And yet there's so much amazing work going on now that allows us to really celebrate this merging of science and holism that really underpins our program. And then, social issues in integrative health, I think, thankfully are becoming quite at the forefront of our field. We know that the kind of broader goal of integrative health coaching is to really partner with clients, right, to support them in formulating realistic and achievable goals to better this, thing we call health and well-being and all of its multifarious expressions. As well as navigating these integrative modalities. And so we know that part of this work we're doing is really, confronting the socialized thoughts that we have, confronting the resources we do or don't have access to, confronting the structural limitations that can arise as we navigate through healthcare, including integrative healthcare. And so, I think we've started to acknowledge that many of the applications of integrative health practices have really only reached a narrow social group. And if we as integrative health practitioners and the broader field are to expand the reach of our work to especially marginalized populations and those who experience structural barriers to accessing this whole person medicine, we really need to move beyond the boundaries of the kind of mainstream wellness community and towards an integrative health that's really culturally informed, that is affordable, that is accessible, right, that is community-based. And so with that spirit, this invitation was put out to our panelists because these are all folks that, I've seen their work, and I think these are just amazing examples of the ways that we're seeing change happen. People throughout this field are starting to take a contextual lens to this work to identify these social and structural determinants of health, but really to move beyond that too, right? We've seen so much work on the prevalence of health disparities, but what does it mean to start to shift these things in broad and meaningful ways, whether that's better assessment of social needs and hospital visits, or these groups and organizations like Integrative Medicine for Us, or the work that you're going to hear from our panelists. So without further ado, let me introduce our four panelists to you. Dr. Thakur, and maybe you want to, let me see, how's the best way to do this? Maybe when I introduce you, could you raise your hand on the Zoom so people can identify you? So Dr. Thakur is a North Carolina-based PhD who practices at Atrium Health, gastroenterology. I practiced saying that ahead of time. What a word, you have to say it so often. Really glad to have you. And Kurt Beil, some of you know as adjunct faculty in our Integrative Health Studies department, but is also a naturopathic physician and an acupuncturist, and he's also let me know that he's just come down from the ski mountain. So he's also going to be infusing us with the good mountain energy. Dr. Montpelier is a naturopathic doctor with the College of Naturopaths in Ontario. And then Alison Gause is also adjunct faculty in the Integrative Health Studies Department and an oncology patient navigator. So I think I'll start with you, Dr. Thakur, and please everyone feel free and correct my pronunciation if I'm getting your names wrong. But I'd love to just hear from you about your research in brain gut therapy for functional heartburn.
Sure. Yeah. So Dr. Elyse Thakur, I'm a clinical health psychologist in the Division of Gastroenterology and Hepatology at Atrium Health in Charlotte. I'm also an adjunct assistant professor in the Department of Psychiatry and Behavioral Medicine at Wake Forest University School of Medicine. So clinically, I think I'll talk broadly about what I do and then talk a little bit more about the research. So clinically, I see patients with a range of gastrointestinal disorders, which I treat with brain gut psychotherapies. So I've conducted several studies on psychosocial factors and/or behavioral interventions for patients with disorders of brain-gut interaction, also known as functional gastrointestinal disorders. And most of the studies I've conducted have been on patients actually with irritable bowel syndrome, but some work I've done has involved other disorders like functional heartburn. So let me just kind of update you at the most evidence-based interventions for patients with these disorders, broadly speaking, include GI-focused cognitive behavioral therapy and gut-directed hypnosis. However, other interventions targeting unresolved distress and oftentimes relationships that have been difficult include emotional awareness and expression therapy, and that is something that I also studied very extensively. So just to give you a little bit of background on that, is that that's an intervention that includes helping an individual to identify, experience, and express emotions related to those types of stressors. So in a randomized controlled trial, we found that brief emotional awareness and expression therapy was actually quite effective compared to traditional approaches like relaxation training, which also has benefit compared to controls. So that just gives you a little bit of background about the types of treatments that we've used in this setting. And other kinds of up and coming psychological interventions include acceptance and commitment therapy and mindfulness-based work, but I haven't done as much work in that area. But as we're talking about these different types of interventions, I'm not sure how familiar people are with these types of treatments. So I'm happy to answer any questions you might have related to how they work and the studies that have been done. Another really important kind of thing that we have to think about is how, psychosocial factors or other types of influences have really, contributed to difficulties people have with these types of gastrointestinal problems. We are, as a clinical health psychologist in a medical setting, I think it's really important to consider the whole individual, and that might be very relevant to the work that you all do. But I think it's really important to consider what factors might influence someone's whole health. And that's why I got into this work and why I'm doing all these different types of studies. And that's a really important factor when considering often, what treatment options we do have available from an integrative health perspective. In the past, I've also done research that has examined how to close implementation gaps by developing things like referral resources for gastroenterologists to help them identify appropriate types of patients for GI-focused behavioral health care. And so, a lot of my work, again, has focused on irritable bowel syndrome previously, but, this can also be translated to a larger range of conditions. But these tools are really essential because allowing providers to understand who to refer to these type of services is also really important, and that will improve access to care, which is something that sounds like, you all are doing in your program too. So that just gives you a background of my area, broadly speaking. I, have done other type of work on different types of cases, and I've even gotten patients off medications with this type of work. So it's really, really interesting that when we bring in these integrative approaches to our clinics, that we can do amazing work and we can have a big impact on people's lives. So I'm definitely open to questions, comments, or even connection.
Amazing. I think I'm going to have a save questions for the end, but it's so exciting to hear what you're up to. And definitely, folks, if you want to put your questions in the chat, please feel free. And I forgot to mention from our panelists that Scout is going to put the little timer emoji up to encourage you to wrap up if you if we're going over time. So I'm going to move us over to Dr. Beil, who's going to talk to us about his research on nature-based therapy.
Yeah. Can you all hear me? Yep, sweet. Okay. Well, thanks very much. And it's always good to share this topic with people, especially this group here. Yes, I am, up on the mountain, was skiing all day, end of the season. So we're getting snow. We got to hit it while we can. So I like to walk my talk. Yeah, so I'm a naturopathic physician and acupuncturist. My research is in the psychophysiological benefits of exposure to natural environments. And I got interested in that topic because, I'm a nature lover. That's why I came to naturopathic medicine. And when I heard that there was research out there that we could try and quantify what the benefits of being in the outdoor natural settings are, that just rang every bell in my body. It was like, oh, this is actually a thing that people can do. That's amazing. Because I think we talk a lot about environmental influences on health, and it's kind of a no-brainer to say, oh, we'll just go out to a nice relaxing beach or take a stroll in the forest and feel better. And a lot of people take that for granted as okay, of course, but crossing over into making that a medical intervention, we need to have data, right? We need to try and quantify that, and so that's some of the work that I've helped to do. So some of the research studies that I've done, we took people out into different urban settings, from a very natural setting to a very built setting and different grades in between. And we quantified their amount of stress reduction, both physiologically using salivary cortisol measures, both pre and post exposure, as well as psychological measures. So different mood scales, stress scales, how are you feeling right now? That kind of thing. And, this work is not rocket science. Lo and behold, the people that were in the natural settings felt more relaxed than the people that were sitting at the busy downtown intersection, and had lower levels of salivary cortisol. Done other studies looking at indoor exposures. So we had a stressor that we exposed people to, and then had them recover from that stressor in a room that either had a bunch of vegetation, potted plants, flowers, things like that, or just bare empty walls. And we're still analyzing that data. That one was done with heart rate variability, for anybody that knows that biomarker. But the data is suggestive, and the field in general shows that, again, people exposed to natural settings physiologically respond better to natural settings. And the reason that I do this work is to show that our environment matters, where we spend our time matters, especially in the world that we live in, where more and more people are spending times indoors all day. I see, except for Elyse, who I'm not surprised is outside, everybody seems to be outside or inside, and maybe some of you have been inside all day. That has profound impacts on almost every measure of stress that we have. And as you all know from your coursework and the work that you do, stress is one of the major contributors to almost all forms of disease, certainly forms of chronic disease, which are the major impacts in our healthcare system. So getting people to spend more time outside in an area that's comfortable to them is going to ultimately, be more beneficial. How this relates to social, the social aspects that Megan was talking about. We know that underserved populations obviously are both at, our lowest areas of health status, lowest levels of health care, and highest levels of stress. And we have shown, not me in my particular research, but in the field, we've shown that for the same level of exposure to natural environments, people in underserved communities actually benefit more than people at higher socioeconomic groups. It's almost as if their whole being needs these natural restorative features more than somebody who comes from a wealthy background, has more resources, better health care, can afford a babysitter, can afford to take a vacation, all the things that we know are ancillary but contribute to health. People in underserved communities, low income communities, urban, inner city communities, for the same amount of exposure to a natural setting, we see vastly greater improvements in physiologic health measures, lower blood pressure, lower cortisol, lower measures of stress, higher levels of perceived well-being. I could go on and on about all the things that the field measures, but that's the gist of what the work I'm trying to do is, and that's that.
Thank you so much, Kurt, and thank you for walking the talk. And I would love to pass it over to Dr. Montpelier, and she's going to talk to us about her research in health literacy in integrative medicine. And I will come back and do another round with folks on social issues. Kurt, you went right for it, so we'll skip you on that. But if folks want to just share their research, and then we'll do another round. And so when you are ready, Natacha, go ahead.
All right, I'm just gonna share my screen because I am very much a visual person.
Yeah, I was hoping we could drop the slide for a minute just so we could see you and others. Thank you.
Okay, I want to make sure that that is right. Okay. All right, so you should see a green slide.
Yep, we see it.
Okay, perfect. All right, so like Megan said, I'm Dr. Natacha Montpelier. I am a naturopathic doctor. I'm in Canada, and I'm also a medical education and research specialist at Fullscript. And Fullscript, for those of you who don't know, it's a health technology platform within the integrative medicine space that is kind of more of a dispensary, so it specializes in dispensing supplements. However, over the last few years, we've been really focusing on trying to do more medical education and more research. And this is what's brought us to studying health literacy. So last year we sent out a survey to our patient users, and basically we wanted to find out about their baseline health literacy levels and also health literacy within their clinical appointments and some of their educational needs and barriers. So here are some of our demographics. Now, if you kind of skim that, you can kind of see that it's not really, representative of the American population. However, we've kind of looked at other studies, and it seems that maybe this is a little bit more representative of like complementary and alternative medicine users. But just keep in mind these demographics as I go through the results that we got from our survey. I've just divvied these results into personal health literacy and organizational health literacy. And just for those who are not too familiar with health literacy, personal health literacy is the degree to which a person has the ability to find, understand, and apply health information. So we asked our patient users their self-perceived levels of health knowledge. So on the left, we have their overall health knowledge, how they would rate their overall health knowledge, which most of them said moderately knowledgeable. And on the right-hand side, we had them rated according to specific topics. Now, for most of these topics, they're kind of falling within the moderately knowledgeable and very knowledgeable, except for supplements and environmental health that you can see at the bottom of the slide. They're just less individuals indicating that they're very knowledgeable in these topics. Now, health literacy is not just about health knowledge. We also asked our patient users about their health-seeking behaviors. So we see on the the left-hand side that most of them agree, somewhat agree or strongly agree that they can easily find reliable health information. And most of our patient users indicated that they look for health information a couple of times per week. And we also asked about the most common and trusted sources of health information. So healthcare providers are the most common and also the most trusted source of health information. But I do want to point out that in the most trusted sources, we see that medical and scientific papers are the second most trusted source of health information. But when we look at the graph on the left-hand side, with the most common sources of health information, medical and scientific papers are actually the fifth most common source of where people would get their health information. So indicating that maybe people understand medical and scientific papers are trustworthy, but perhaps these resources are maybe hard to understand or maybe even apply the findings from this research. Now, there's also organizational health literacy, and that's the degree to which organizations equitably enable individuals to find, understand, and apply health information. So here we asked our patient users to think back to their most recent appointment. And the majority of these patients strongly agreed that they understood why their healthcare provider recommended their treatment plan. They understood the treatment plan instructions provided by their practitioner. They were able to carry out the instructions, even though that was a little bit lower. And they felt comfortable asking questions about their treatment plan to their healthcare practitioner. We also asked about educational materials. Now, most of them agreed that they either somewhat often or often receive educational materials to consume outside of their appointment. And they also strongly agree that these educational materials are easy to understand. And then the last part here is just patient educational barriers and preferences. So the top two barriers indicated by our patient users were they don't know where to find reliable health information, and they don't have enough time to look for this health information. And what was kind of surprised me is these educational preferences is that most individuals indicated that they preferred written educational material, and that could speak back to our patient demographic. I was expecting more video to be higher up there, but written educational materials that take either less than 5 minutes or up to 20 minutes to consume. And that was all of the kind of key findings from our research. So I'm just going to stop sharing my screen here.
Thank you so much. And we'll definitely ask folks to follow up with their papers too, because I know I want to look at those graphs again. What, informative information. I'm excited to hear how you're thinking of applying it. Before we get there, let's give a chance to Alison Gause to talk to us a little bit about how leveraging hospital-based quality improvement research that demonstrates the need for integrative health services for cancer survivors might happen. Go ahead, Alison.
Thank you, Megan. I feel like it's a natural segue after Natacha's research presentation for me to talk about the project that I'm involved with. So I am working on it's a community-based cancer center where I work as a patient navigator, and I'm involved in a quality improvement project, which is addressing the needs of cancer survivors through post-treatment education and linkages to online resources. And so a little background on this project. So in the cancer support literature, it's been widely shown that when people end active cancer treatment, they can encounter a number of unmet needs. And just to cite one national study by the American Cancer Society by Berg, who is the principal investigator, they did a qualitative study with about 1,500 cancer survivors, and there were a number of different types of cancers that were represented, including breast, prostate, colorectal, bladder, uterine, skin cancer. And they surveyed this group on their top needs, and the top 3 needs were physical needs, which comprised of 38.2%, of individuals. The physical need category included symptom management, pain management, also diet and nutrition, exercise, physical movement, and also sleep. The second greatest need was financial, and that was around 20%. And of course, these related directly to affordability of treatment, medical bills, insurance, and the affordability of services after treatment was completed, including things like integrative services. The third top need was education and information, and this was about 19%. And these needs related to a lack of knowledge in certain key topics that individuals had. So there's definitely a lot of gaps in care. And so at the community hospital where I work, the current standard of care when an individual ends active treatment is that they meet with their oncologist and they get information on their follow-up, when they're due for their doctor's appointments, when their surveillance imaging is scheduled, and they receive information on wellness services. They may get a referral for physical therapy, etc. But individuals are really left to their own devices to seek out this information, follow up on appointments and referrals, and actually access the resources. So because of this, many people may not seek out, nutritional guidance or, exercise support or stress reduction services. And all of these different wellness services are so important to recovery and long-term health. And especially when we're talking about social determinants of health for ethnic or racial minorities who may speak, English may be their second language, it's even less likely that they'll get the information and resources that they need. So we are doing a pre and post intervention study. And so what we're going to be creating, our intervention, is a personalized education packet that's going to be delivered to individuals at their final treatment appointment or their final doctor's visit. What this packet is what's going to be included in this packet is information on their treatment, so a summary of their treatment, information on their follow-up with their doctors and their surveillance imaging, and also information on managing side effects, potential side effects of treatment. There'll also be information on nutrition and nutrition resources, exercise counseling information, research on the importance of exercise after treatment, and also information on emotional support and how important that piece is to recovery. And then there'll also be information on community resources as well. So the methodology of our study, as I mentioned, it's a pre and post intervention study. So we're going to be surveying a cohort of 50 individuals who ended treatment in 2022. We're going to be sending them an electronic qualitative survey with a number of statements to evaluate their experiences after they ended treatment. So this is the pre-intervention group. We're going to be using a Likert scale, and we're going to be assessing if they felt that they had clear information about their medical follow-up, their imaging and tests that they needed, that they felt they had access to information on how to reduce the risk of recurrence, or on like smoking cessation or nutrition. We're going to be assessing for if they felt like they had access to information on how to manage side effects and who to contact for support with managing side effects. We'll also be asking about if they felt they had knowledge about resources for emotional support. And also, we're going to have a free text question about what needs they had that were unmet and how they could have been met in a better way. So based on the data that we collect, we're going to use that in our intervention, and then we will start our intervention probably in about 3 months. And then we'll be evaluating the post-intervention group. So we're going to be looking at a cohort of 50 individuals who complete treatment this year, who get the education packet at their final visit. And we'll be evaluating the impact that education packet made. Another key part of this education packet is that we are creating an electronic QR codes on all of the education handouts that will be in this packet, so people can easily scan them with their smartphone, and it will link to a website that we're building out on our hospital's website. And this website will have, it will be kind of a comprehensive library of all kinds of different resources, including services both at the medical center, but also in the community, free resources available, information on parks. I just came across a wonderful resource on Qigong in parks in Marin County. Really looking at cost-effective support resources for individuals and having them on a website available. And so how this relates to social determinants of health. So we're really addressing healthcare access and quality. And at our hospital, about 10% of our patient population is Latinx. And so we're really looking at how to tailor these educational resources in a culturally sensitive and linguistically appropriate way, and also providing resources that are for our Spanish-speaking patients. We're also addressing the affordability aspect of social determinants of health through making sure that all of these resources are available to any cancer survivor, regardless of ability to pay, and really helping people to connect with these resources to improve their recovery and their healing after treatment.
Alison, thank you so much. What amazing work you're doing. And I can't wait to hear more about it. It's so great to see, all the things you're doing outside of CIS. And I know there are many. I'm going to hand it over back to you, Dr. Thakur, if you want to talk to us a little bit about it, just briefly, in maybe under 2 minutes, what you think are some of the most important social focuses related to the applications of your research.
Sure. Yeah. So like I said, I think a lot of the work that I'm doing really focuses on highlighting how do we improve access to care for people who may not have access to specialized services otherwise. And a lot of the patients that I clinically work with are from various different backgrounds. So they might not even be aware of these types of interventions, that they're even a thing. So I think it's really important to understand that, we can improve access to care for people by integrating behavioral health providers and other types of specialty providers in traditional medical settings. And that will certainly help people get services that they may not have gotten otherwise. So a lot of the research that I have done in the past has focused on, interventions, but also, like I said, referral resources so that we can certainly identify appropriate candidates for care and close those implementation gaps. So thank you so much.
Amazing. Yes, thank you. And Dr. Montpelier, same question for you. And also I'd love to hear if you did have comments on Alison's work, because I know there were links there. Feel free and share.
Yeah, just wonderful work, and definitely there's a lot of crossover there in regards to health literacy and the educational toolkit almost that you're putting for your patients. So I guess what I want to say about health literacy and the research that we conducted, as you saw when I showed the slides, like the results from our specific study can't really apply to everyone, but the hope is that more organizations and individuals who deliver care or provide education to patients or clients would do similar type of work in discovering their patient population so that they can deliver care or deliver education to their patients that kind of are very customized to their patients. What we found, in addition to the survey that we conducted, we also did a literature review, and through that we found that anyone can struggle with low health literacy, and there's national and international surveys that found that 40 to 60% of North Americans can actually have low health literacy. But there are specific groups, and those groups fall within the social determinants of health, that are especially vulnerable to low health literacy. And so what we're hoping with this study and other studies like it is that we can really tailor our information and address some of these gaps so that everyone can benefit from education, not just those who have, greater educational attainment or are in a higher social economic status. Let me just see here. There's something else I wanted to mention. What I wanted to bring it around to is that health literacy in a kind of bridging that gap and helping all of our patients have higher health literacy is important, just because individuals with low health literacy, they have a higher risk of having higher emergency care use, decreased preventative use of preventative services, as well as increased risk of death. So investigating our patients' educational barriers and their needs can really help bridge that gap, and everybody can then benefit from these resources.
Yeah, thank you so much. And I'm just, every time we're talking about the gap, I'm like, this is what health coaches are for. Like, you are the bridge, Yeah. And so I'm just really excited for that. I think we have time for maybe just one question. So if you've got something brimming, I didn't see anything in the chat yet. So if you want to just do a hand raise, I'm happy to hear your questions for any of the panelists. I know that was like rapid fire amazingness, so you might just be integrating. Well, let me ask for any of the panelists then, sort of if you imagine one of our integrative health coaches with a client, and they come in with the packet from your research, and they're like, what do I do? How do I enact this in my life? What do you think would be most supportive for the coach to do with that client?
I can go ahead. So I think that just like one-on-one, I guess, which can be part of your intake with your new clients or patients, is asking about their educational needs and barriers. What language do they prefer receiving education in? Do they have access to digital devices, the internet, computers, or even library or newspapers, just figuring out what access they have to education. And then that when you are providing them education, if it needs to be a printed copy and which language that they prefer, or if you can send them an online resource, sending that to their email if they have an email. So I would say just kind of gathering one-on-one. You can do, like we did a big survey with our patient users, but you can also just do one patient at a time, just gathering that information so that they can actually use that information. And just the second thing I'll mention is that whatever education you provide your patients, go over with them that education during your appointment. There's no guarantee that they will read that outside for many different factors. Again, it could be that they don't have access or they don't have time. So go over that information with your clients and your patients during your appointment, and then make sure that they can actually go back and actually use the resource that you've provided them with.
Thank you so much. And I know the Integrative Medicine for Us group, I think you have to become a member, but it's sliding scale, and they have so many tools too for, assessment of what social resources are available to a client, so that you're, not assuming that people have access that they don't have, and working within the access that they do have. Maybe one last panelist, just briefly, same question, any kind of takeaways? Yeah.
Yeah, I'll go real quick. So one thing that I ask every patient that I work with in my intake form, and then we bring up is two questions: how much time do you spend inside or outside per week, and how much time do you spend on a screen? And contrasting those two answers is very enlightening, usually for people. It's usually much higher amount of time on a screen than they spend outside. Sometimes, order of magnitude of 50 or more. Just getting people outside. Research is pretty clear. People are working towards, just like we have recommended daily allowances of certain vitamins. Some researchers are looking at what is a adequate minimum dose of nature or outside time, and it's looking at the latest research is looking at somewhere between 120 to 150 minutes a week as a minimum, which is not a lot. But many people do not achieve even that. So, one thing just real simple that you could do with your clients is just ask them how much time are they spending outside. Somewhere in a park or something like that would be ideal, a garden. But even if it's just walking around the block, that can be helpful. So, yeah.
So Kurt, this is Meg. Hi, Kurt.
Yeah. Hi.
I really want to comment on what you're doing and this, looking at nature and the work of some of our students as they do their thesis, and some of our graduates, like Michael Cragen has done phenomenal work. He's here. I'm so glad to see he's here in Tucson, and on technostress and teens and young kids. And here he is. A lot of them are working at digital platforms now. That's very often the first job they get hired at as a coach is digital platforms, texting. This is where therapy's even going, lots and lots of online work. And we have other students right now about to graduate who are also looking at the effect of that much online time for young girls and their own body dysmorphia and every problem that starts from that. So it's this great irony of our time. Here we are connected online together, and here you are yearning to get out on that snow and play. And so it's this extraordinary balance that we are all trying to achieve right now with the reality of this life. So appreciate the panelists' discussion and the way it ties in to these careers that our graduates are looking at, and whether it's teaching health literacy or looking at cancer resources for patients, or even what is the amount of time I'm spending online, and is it, what is the effect on me? So thanks for illuminating all these topics for people. It's really been great.
Wonderful transition to starting to celebrate our alum. So I just want to thank all of our panelists for your amazing work. And I know, people are going to want to follow up. So we definitely will do that. I appreciate you making the time. You're welcome to stick around for this next short part of just celebrating a few of our alum, or goodbye and thank you. And folks,